My name is Michelle Murphy. I am the team lead of behavioral health services for the rural counties.
Okay.
And I'm Paula Brunn, and I'm the lead manager for behavioral health services.
All right. Thank you very much for being here. So, tell me a little bit about Northkey.
Sure. Northkey's been around since 1966. We were not the first community mental health center in the nation, but we are the oldest in the nation. There was one other that started before us but has since closed. So we've been around a while, since 1966, and we provide services for mental health, substance use, and intellectual disabilities.
That's a lot. It's a lot of different things. And then tell me a little bit about what you do.
Yeah, so I'm the team lead of outpatient services. So I work mostly with the rural counties. I'm in Gallatin, Grant, Owen, Carrollton, and Pendleton.
Okay.
I actually started out as a school-based therapist in Grant County at the elementary school mid-pandemic. But just to talk a little bit about Northkey and our mission and our values. So our mission is transforming lives and communities through excellence in mental health, substance use, and developmental disability since 1966. And our vision is Northkey Community Care will be recognized as the leader of integrated primary health care for individuals and families with behavioral health care needs and developmental disabilities.
Okay, so when you all say, I mean, I can guess, but when you all say outpatient, what are you telling me? What is that? What does outpatient mean?
So it's easier to tell you what it's not.
Okay, hey, that's good. That's
outpatient services are all those services that can be accessed via outpatient and not inpatient.
Okay.
So we don't have anything residential.
Okay.
Everything would be either through our offices, in our office, or it could be through telehealth, where the client can connect with services from their home.
Have you all then seen a big increase in telehealth?
Absolutely. It was not long once the pandemic had started that we first walked into telehealth services.
So just a little bit, how does that process start for any one of your services? Like, how does someone get connected?
Sure, absolutely. They would contact our access line, which is 859-331-3292. Someone from our call center will answer that phone call and will obtain their information, and then they will be set for an intake. So the first two appointments is getting that behavioral health screening done, determining what it is that the individual is looking for as far as services, doing a biopsychosocial, just getting some background, and then they are, for their third appointment, connected with a clinician along the lines. Through those three visits, referrals can be made to many of our other services that they may be looking for.
Okay. Okay. And so then, is that typically someone realizing they need help and they reach out, or is this like you referred, or kind of like, what would bring someone to that point?
It's a combination. We have folks who reach out on their own, and then we also receive referrals from physicians, from Sun Hospital, St. Elizabeth Hospital, sometimes from courts. In Northern Kentucky, we're involved with drug court and also mental health court.
So you all don't have any residential, though? It's all outpatient?
Our IDD services have what is called SCLs, but it is not residential.
Okay.
It's more in-home.
Okay. Okay. So you're able to meet them
where they are.
Yeah, where they are. Okay, so, and this is just kind of a vague term, so you can take this, any way you'd like this. And so when someone's in treatment, I guess, what are some of the different treatments and kind of like outcomes? Kind of how does that work? So they've gone through the first two steps. They're in their third. You said like the meeting at that point. What does that kind of look like?
So I'm going to take a step back.
Mm-hmm.
I do want to point out we do have crisis services also. So there are times when folks are in crisis and would not be able to necessarily wait that 7 days to get that first appointment. So we have crisis staff available to be able to talk through, assess for safety, and to get them in services quickly.
And that can be accessed through the same phone number you.
Correct. But at that third appointment, when they're meeting with a clinician, they're talking about their treatment. They're talking about what is that individual's ultimate goal. Then we look at what barriers are getting in the way. And we talk about those barriers and address which barrier they would like to tackle first, and then our services are then wrapped around that. How do we give them what they need to overcome that barrier in order to reach that goal that they have?
You've all discovered or cost or whatever went to work, but really the value and the importance of being able to keep people in their home for services, right? So, because you mentioned it a couple different times that so that's just very valuable in helping people in their recovery process.
Absolutely. I don't know of very many people who enjoy being in the hospital. Everybody usually typically wants to be at home in their surroundings.
If you enjoy it, there's usually some other issues at work, a little bit beyond that too. So that makes sense, yeah.
Yeah, with their supports that they have near them, their family, friends, loved ones, making those connections, those bonds are huge and important for all of us. And it's no different for someone who's struggling with emotional diagnosis, mental health diagnoses.
Okay, so you all mentioned services, and that's, I'm sure it makes crystal clear sense to you all, but can you give me some examples of I know you all have a lot.
Yeah, well, first of all, we have outpatient, which we've referred to quite often, but basically what that looks like is adult counseling or child counseling, and that can be one-on-one. We also have, family therapy, marriage counseling. We have groups. So we have, a domestic violence group, an anxiety group, and things like that as well. So that's where you're working, like Paula said, either in the office or over Zoom with your therapist, either one-on-one or in this kind of group setting, to do therapy. So that might look like, meeting your therapist and discussing your therapist listening. You work on an intervention together, hopefully towards your goal that you've created in therapy. So that's kind of what the outpatient services look like.
We also have a group that we call it TAY, but it is Transitional Age Youth. And it's for folks between the ages of 16 and 25 who are struggling with severe mental illness. And oftentimes the first episode of psychosis, when something like that happens, there are lots of questions, lots of fears, stigma, and such that go along with that, not just for the individual experiencing it, but also the families. So our TAKE program, or our Transitional Age Youth program, is a case manager, therapist, psychiatry services for psych meds, peer support, and then group services. And this is where they just kind of wrap around services around the individual and the family or the loved ones of the individual experiencing those symptoms for the first time, to ensure that they get all of those questions asked.
Do you, for lack of a better term, what are some of your most popular services? I mean, you mentioned like TAKE. I mean, is there's other things similar to that for different issues, if that's the right term?
Absolutely. We have targeted case management. Specifically here in the rural counties, our targeted case manager focuses on housing insecurities, food insecurities, maybe even helping with appointments and care coordination. It gets a little more specific up in the northern counties where we have specialized employment services and housing, but our case managers here in the rural counties can also focus on those things. So, helping locate jobs that they may be eligible for, helping them fill out an application or write a resume. They can help with those sorts of things. Then we also have peer support. Now, peer support are folks who have lived experience. They've either themselves been diagnosed with a mental health disorder, or they're in recovery and have experienced a substance use disorder. And they are here to come alongside of the individual and say, I've been there. we can do this. We can get through this. And here's some of the things I've tried that may work for you. So when you ask about the most popular, I'm going to say yes. Honestly, we keep very busy
You're right. Yeah.
with all of those services.
Is there anything you'd like to add on that?
I mean, Paula mentioned it before, but we also have the ACT services, which is similar to TAY in that it's a lot of wraparound services. So you get like a med provider, you get a case manager, therapist, and all of that. But it's more for severe mental illnesses. So that might be like major depressive disorder or bipolar or PTSD, things of that nature. And it's for people over the age of 18. So that's a really popular service as well, I feel, in the rural counties. The main goal of ACT, like Paula mentioned before, is to keep them out of the hospital. Like we don't want to keep having to go to the hospital. You get out, you have to go back again, right? We're trying to help meet those needs where you are, meeting you in your home or in the community, to just try and keep preventing the hospitalizations.
So, and then I would imagine that you all partner with a lot of different organizations, because I'm thinking just kind of like some of the things you just addressed. I think like in the case of veterans, these could all be veterans issues too, or like the VA and DAV or stuff like that too. So you all have to be really aware of your other collaborators too. So not only do you all have to know a lot about the actual part, but the community involvement to where that could really help people on something like that. Okay, so you all mentioned like food insecurity, housing. I guess what are some ways you all try to address those barriers on that? And I realize that sometimes in Northern Kentucky it's a little bit different than the rural area, but what are some ways that Northkey's been successful or attempts made? Or
So again, in the more urban counties, we have specific teams that work with the homeless shelters.
Okay.
And of course, throughout all of the counties, we all have access to a list of resources to be able to connect people to provide those needs.
Yeah, I think one of the most important things in the rural counties is we're connecting with our community, right? So the way that we learn more about that is by going to these different meetings and people like, hey, we just opened up a new food bank, and then we can report that back to our therapists and our case managers and things like that. So it's important for us as the rural counties, gotta be in your community and understand like what our community offers and be able to make sure our therapists are aware of what our community offers.
yeah, I could definitely see where being just a warehouse of information probably is very, just being aware of what other people are doing. And you only kind of know that being in the field. I kind of feel like that. Like we obviously want to help people with information, but it's like we're not in it day in, day out, and the changes and stuff. Like a grant could come along or something like that. This is just kind of a bigger questioner that I have, but what are some trends that you all see overall in your services, and just kind of, we mentioned a little bit like telehealth. That's, a lot with the last 3-4 years, I'd assume it's really accelerated like everywhere, right?
Yeah.
But what are some other kind of trends or stuff that you all are like in the last few years more active in?
Sure, absolutely. One of the services that we haven't even begun to talk about is our medical services. We have an MOUD program, or a medication for opioid use disorder program, and a MAT, medication assistant treatment, for folks who are struggling with substance use disorder. And then we also have primary care services. We actually have 3 primary cares in our outpatient offices, and then we also have a primary care mobile unit that would love to come out to any type of festivity or community gathering to help promote those services. So not just treating the mental health or behavioral health part of it, but also understanding that there's a physical side to this too.
Okay, so those were the medical, and you mentioned kind of trends on that. Is there anything else that you all would want to add, like maybe on things that you see or that you all are working on? You're working on a lot all the time. I understand that, but just maybe something that's drawn your attention a little bit more lately.
I think one other area that often doesn't get spoken about from our end in the outpatient setting is we actually also have preventative services. And those preventative services will go to individuals, large groups, schools, and they'll just encourage healthy choices about alcohol, tobacco, and other drugs. So those who are at risk for substance use and expecting a baby, they would qualify for some of those services and not even necessarily have to be a Northkey client. But there's many different preventative services. We go into the schools, do educational, psychoeducational type things that wouldn't be necessarily, individual therapy type of setting, just to provide that information.
I would say just overall, I feel like, especially since the pandemic, there's just a higher need for services. The pandemic left a lot of people, isolated in their homes and away from their social support systems. I feel like we've seen an increase just in need, and just trying to meet that need constantly has been what Northkey has been trying to do.
I feel that a little bit too at our library level. It's like where did they all go? People who would come in the library, and we're kind of same thing. We're seeing some different trends too. Whereas once upon a time, we used to have many public computers in here, and we'd get, let's say, I think in 2014 we had like 17,000 uses of the public computers. Last year we did 1,700. So people are getting more isolated because they have their own phones.
Yeah, I would say Northkey started offering way more like telehealth and all of that than we ever did before. And that's the same with our therapists. I mean, we have on-site providers, but we have a lot of telehealth providers as well, that we've added on, since the pandemic. So that's, I feel like, a trend, just in therapy in general. It's a lot of therapists are enjoying the telehealth aspect of that.
Yeah, just logistics, or let's say you're somewhere in Covington and you're drive, just all that can be like you all are mentioning. You're trying to remove barriers, and in that case, the Zoom call or that works just as good.
Yeah, and that's a big barrier in the rural counties too. Like, the counties are so much larger and more spread out than they are in the urban areas. So, driving 30 minutes to go to a therapy appointment when you can just do it from your home on your phone,
And yeah, because now all of a sudden you have issues with a car, or you have issues with childcare, or you have issues, work, or what other programs are you two sitting on that we haven't discussed?
We haven't talked about 988.
Okay, let's do it.
So it used to be called the National Suicide Prevention Line. Now it's the National Crisis Line. And Northkey is one of the call centers in the Northern Kentucky area for that. So we have folks who answer the calls 24/7 for a crisis. It's an additional crisis line. We have our regular crisis services. That is the number that we talked about before, same access line, but we also have 988. With 988, again, they don't have to be a Northkey client. They don't even have to share who they are, but they can reach out for supports, resources, can be referred to whatever type of service that they're looking for with whatever provider they're looking for. So that is one of our newest services that we've got. And we answer close to over 200 per month, calls per month on that line. And it's been interesting. There is a special, when you dial that, you can be, for veterans, be connected with veterans, or you can be connected with any type of language service that you're looking for. They have text and chat. However, we are not yet there. Our organization isn't. However, that doesn't mean that somebody wouldn't answer your call if you're in Northern Kentucky and you're texting or chatting. Somebody would. But sometimes it's nice to know that if you're in the area and you're making that call, you are talking to somebody who is also in the area and is aware of services that would be close to you and barriers that may be familiar, such as transportation services or that sort of thing. So that's another really big service that we've got going on. And it's been interesting because not only do we get adults who call that line, but we also get children sometimes. The youngest child that I remember calling was 8. So it's getting that information out there, making sure that information's in the schools, just in the community. it may not be easy to remember the 859-331-3292, but 988 is pretty much easier. And so we've really seen some success there. It's definitely to help de-escalate any type of crisis that's going on and connecting them with medical emergency service. But you don't have to be in crisis yourself. It could be concerned about somebody else and looking for resources. So there's a variety of different types of calls that we get.
And 200 a month, it's a lot. I mean, that's a real hard metric to at least that first step. Okay. Anything else?
Probably, but it's not coming to me at the moment.
That's all right. This has been great. This has been I'm learning a lot. So I hope anyone.
I will say that, along with our substance use services, we do have intensive outpatient or IOP groups and substance use groups, depending on the level of need. So for folks who are in the rural counties and need to be connected to one of those, we can connect them via telehealth. And for those who struggle with the technology or don't maybe have the services that they would need to be able to utilize the technology, they are more than welcome to come into our local office, and we will connect them from the office to the service provider.
Well, that's great, though. Do you have like a computer, not computer lab, but like
we use tablets.
Okay,
Yeah.
okay, that's great. So that's great, and that's great to also have that space, because like some people probably in their house maybe they don't have the, for whatever, could maybe Wi-Fi, could be a loud house, could be a lot going on.
Right.
Maybe you don't want to talk about the stress of your children in front of them.
Sure.
Yeah, and that's one thing we as therapists really need to make sure with telehealth is that we're providing like confidential services, right? Just like if they were in the office, right? So making sure they're alone and all that kind of thing. And if they're not able to do that at home, they're more than welcome to come to the office and use one of our tablets.